This important message is brought to you by the Gershon Law Firm, where our lawyers are also medical doctors. Oxygen deprivation at birth can be serious. When a baby's brain does not receive enough oxygen during labor or delivery, it may lead to medical complications that require careful evaluation and follow-up care. One possible condition is hypoxic ischemic encephalopathy, also known as HIE. HIE can occur when the brain is affected by reduced oxygen or blood flow around the time of birth. Possible long-term concerns may include seizures, developmental delays, motor problems, learning challenges, or cerebral palsy. The outcome can depend on how long the oxygen deprivation lasted, how severe it was, and how quickly the medical team responded. There can be different causes of oxygen deprivation during birth. Possible causes may include placental problems, umbilical cord complications, fetal distress, prolonged labor, infection concerns, or delayed delivery. Doctors and delivery teams are expected to monitor both mother and baby, recognize warning signs, and respond appropriately when a baby may not be getting enough oxygen. Warning signs may appear through fetal heart rate monitoring, changes during labor, problems with the umbilical cord or placenta, or signs that labor is not progressing safely. Not every case of oxygen deprivation means medical malpractice occurred. Labor and delivery can change quickly, and medical teams often have to make urgent decisions. However, when a child is diagnosed with HIE, cerebral palsy, seizures, or developmental complications after birth, families may want to understand what happened. Important questions may include: were warning signs recognized? Was fetal monitoring reviewed properly? Did the delivery team act quickly enough? Was a C-section needed sooner? And could earlier action have reduced the risk of injury? Medical records, fetal monitoring strips, delivery notes, newborn records, and hospital timelines may help explain whether proper steps were followed. If your child experienced complications related to oxygen deprivation at birth, you may have questions about whether the injury could have been prevented or whether medical negligence played a role. The Gershon Law Firm helps families review possible birth injury and medical malpractice cases. Because our lawyers are also medical doctors, we understand both the medical and legal sides of these cases. This video is for educational purposes only and does not constitute medical or legal advice. If you have concerns about a possible birth injury, contact the Gershon Law Firm for a fast, free consultation.